So thank you very much for this invitation. Here's my conflict of interest. I would suggest everyone to use the crowdfunding idea, which was very successful in our latest study, which was pretty negative for e-cigarettes. It's going to be published hopefully soon. So we know that e-cigarettes are new in the market, that they are used by millions, that there is no tobacco, no combustion, and we believe that any regulation, as with any other product, should be based on scientific evidence. There are many unique features in e-cigarette. They are used not as a new habit. They are not introduced like smoking was introduced in the past decades. So there is no marketing, and we as scientists don't promote the e-cigarette use into non-smokers to become vapers, e-cigarette users. We're promoting it as an alternative to smoking for those established smokers. Of course, we have aerosol instead of smoke. There are many unique features that are not present in tobacco, and we have to realize that. The use of humectants for vapor production. Of course, there is heating that is needed, but the temperatures are much lower compared to the temperatures of combustion of conventional cigarettes. The e-cigarette uses flavorless unless flavors are added. So even for tobacco flavors, there is no natural taste or smell of the e-liquid. You must add some flavorings into the liquid. The e-liquid is very easy to make. So there are thousands of manufacturers all over the world. People are even producing e-liquid in their own houses. Some don't have even dedicated facilities. And for the device part of the e-cigarette, mostly made in China due to very inexpensive labor. The regulation, of course, is inevitable, and all scientists ask for regulation. Even the industry hopefully asks for regulation. We must have standards in production procedures, in the composition and the quality of the materials used. And this is essential not only for the consumers, but also for the industry staff in terms of safety in production, especially for e-liquids. We should remove all avoidable risks for the product, because of course we know that the e-cigarette is in general better than tobacco. That doesn't mean that we have to accept any risk that can be avoided. Of course, we must take into account that all of the regulations should be cost effective and should maintain the current rate of innovation, evolution, as well as the availability and acceptability of the products by the user. And of course, the regulation should take into consideration the protection of unintended use or abuse, for example, in non-smoking population, mostly in adolescents. So we know that there is an EU regulation already, asking mostly for laboratory studies in terms of safety, studies in liquid and vapor, as well as toxicological evaluation according to the TPD of all ingredients, which is something that cannot be easily implemented, probably of the products, not of the ingredients, of every ingredient separately. But in order to implement and further define the regulation, because it's just a vague expression now in the TPD, we must define what should be the comparator. Should it be using nothing, clean air? I suppose that most of us agree that it shouldn't be the case, because, as I said, the cigarettes are marketed for smokers as a substitute, as an alternative product. So it's both rational and realistic to use combustible cigarettes as comparator. And we have to define what are the levels of toxins which are, we know that they are released from the cigarette, which are the acceptable levels of toxin from each product. The question is, how much safety? Do we need the safest possible product? I think that the net public health benefit not only depends on safety, but also on acceptability and use by the intended population. So there is a balance between the reduced risk coming from the use of the product and the pleasure perceived by the users, and in reality the use of the product by the users. And we know the example of NRTs, which have a perfect safety profile, as you can see here. They have almost zero side effects, but the efficacy is very small, 70% higher than placebo. So we need to take this into consideration. Defining the e-cigarette. What is the e-cigarette? I think if we want to define the e-cigarette as a single product, we are going to make a misleading definition not only for science, but also for regulators. We have to understand that there is a large variability in devices, in atomizers, in batteries, in the electrical part, millions of combinations, differences in mode of function, difference in design, difference in power delivery. The only common features is that you need an electrical current and a heating source, of course, through the electrical current, and the presence of an electronic cigarette liquid. So, in my opinion, in any regulation, we have to define each of the components separately, because the e-cigarette is the sum of equipment composed of different parts, and every component, every part should have a separate definition. And this definition needs also to be flexible enough to be able to, let's say, predict any future technology. For example, we may see some heating sources without the use of metal coils, perhaps in the future, some ceramic coils or whatever. The standards then should be applied to each component separately. Standards in the electrical part of the e-cigarette, which will define safety, power delivery, battery technology, and also disposal for environmental, ecological reasons. The standards in atomizers, very important. Which materials are safe to use, which materials are safe to interact with the liquid, which materials can withstand the temperature elevation coming from the e-cigarette use, be able to define whether there is any thermal degradation. We have seen some plastics which are degraded when in contact with the e-liquid, and which are the chemicals or the substances that should be avoided when you make an atomizer. And of course, another major part is the liquids, in which we should assess both safety issues for the staff working in the industry, because there is the danger of handling nicotine, especially at very high concentrations. There must be some standards in laboratories producing e-liquids in terms of the safety equipment, in terms of procedures and education of the staff to respond to any kind of accidents, accidental exposure, and so on. And of course, environmental issues. And then, of course, the safety for the consumers. There are some examples which are already established by the industry itself, like the use of USP or European pharmacopoeia grade ingredients like nicotine and humectants. But we have to define the other ingredients that can be used, some solvents, for example, flavors, colorings. These are unknown factors. They have not been tested for inhalation. They come from the food industry. It's probably the best option that we have, but that's not good enough. And we should have also a list of chemicals that should be avoided. We know that the American Liquid Manufacturing Standard Association has developed the only, in my opinion, standards right now for producing e-liquids, and they are quite good, in my opinion. There are many steps that need to be done, but of course they must be endorsed by the whole industry. So, concerning the rules in the production process, as we said, the pharmaceutical grade basic ingredients are already implemented by the vast majority of the industry. As we know, the TPD has set an upper limit for nicotine concentration, which in my opinion is wrong, and is based on the wrong criteria. I think that we should avoid other stimulants added to nicotine, caffeine, for example, beta agonists. There are many ideas. Also, in my opinion, we should avoid colorings for now because we have not assessed their safety when inhaled. And of course, avoid known inhalation toxins. Then we should understand that the emissions coming to the vapor from the e-cigarette use depends not only on the e-liquid, but also on the interaction, and mostly by the interaction of the e-liquid with the atomizer. And of course, the power delivery. So you may have the best quality liquid, which is overheated because the atomizer is inefficient in a liquid resupply to the resistance head. So you will have a lot of toxic emissions in terms of aldehydes, mostly formaldehyde, acetaldehyde. So the regulators need to be properly informed about this interaction, because it is an interaction. So it's not dependent on any single component, but on the combination of these components. And of course, we have to realize that realistically, and it is impossible for any regulation to cover all these thousands or even billions of combinations of different devices, atomizers, and liquids. So we must find a compromise in what we test and how we test it. And this will have, of course, important implications in the testing choices. So, major illiquid issue, in my opinion, is the issue of flavorings, which, as I said, are food grade, the best possible solution until now, but we have to accept that there is very limited research on the safety of flavorings when inhaled. At least, the least that should happen is to avoid the known toxins, because there are chemicals that are approved for use in food, but are toxic when inhaled. And of course, as I said before, we have to define which solvents can be used, if the colorings are safe to be used, because colorings is just added for an aesthetic purpose, they don't have any real effect on taste or whatever, which chemicals should be avoided, and of course define which of the humectants are safer to use. Then, as I said, the TPD asks for toxicological protocols to be, for toxicological assessment of the liquids. So, which protocols should be applied, which cells should be studied, how do we produce vapor on the laboratory, and what kind of devices we use to make this, to produce this vapor that will subsequently be tested. What kind of liquid will we use to test the devices? What will be the pathing regime protocols? These are things that are completely different from our experience with smoking. And of course, will we define an upper limit of toxins that are acceptable to be emitted from e-cigarettes? Because we don't expect everything to be zero. We expect some toxic chemicals to be released, formaldehyde, for example. Should we define any upper limit? Because we need to have data that we are going to use somehow. It's of no use just to produce a test, give the results, and no one ever assesses the results. Unfortunately, the industry, until now at least, is not participating at all in defining these standards. In reality, they have never expressed any opinion, rather than saying that, of course, they support every effort, but that's not an opinion. You know, they have to say what they propose and why they propose this. Unfortunately, there's a lack of expertise, and I think that it's also a matter of mentality, because I think that this should be procedure that should have started from the day one that EU, for example, decided to regulate e-cigarettes. And unfortunately, we see that even for known issues, they do not address them very well. So the latest study that we performed using a crowdfunding campaign was assess the presence of diacetyl and acetylpropionyl, which are two chemicals that are approved to be used as food flavors, but are toxic when inhaled. Everyone knows the term popcorn lung disease. It's bronchiolitis obliterans. It's the typical damage to the lung caused, found in lung transplant recipients. And besides that, which is of course a rare finding, we know that from environmental industrial exposure in food flavoring factories that exposure through inhalation to diacetyl and acetylpropionyl is associated with reduced lung function and obstructive lung disease. So we tested 159 liquids from the market, and we found that 74% of these liquids, all of them were sweet flavored liquids, were positive for the presence of diacetyl and or acetylpropionyl. Although, in most cases, the companies from where we bought the samples clearly mentioned in their website, in their e-shop, that their product did not contain diacetyl. 74 positive. The levels were, on average, twice higher than the currently established limits set by NIOS, which of course are very, very strict limits, and in fact are limits causing no disease at all, but these are the acceptable limits. Of course, I must say that the EU has set the limits somewhat higher, so it is usually about at the level of exposure to coming from the e-cigarettes that we tested. And we found that whatever is present in the liquid goes to the vapor, because we analyzed also vapor produced by these liquids, and we found that, and we expected that, because diacetyl and acetyl propylene are very volatile substances, so everything that is present inside the liquid is delivered to the vapor. So in fact, whatever you find in the liquid is the level of exposure of an individual coming from e-cigarette use, from vapor inhalation. It's a study that is going to be published hopefully very soon in a medical journal. So in conclusion, we support that standards are very, very important, both for consumer safety, both also to make the product more attractive to smokers, and of course to convince the regulators to support it as a smoking substitute. The industry should be more actively involved in enforcing standards, but until now they do not do it. There is a significant risk that the product will be seized by the regulation, just by the regulation. If the limit is set at very high standards, then no one is going to be able to afford it. So we will see a reduction in variability and with all the negative consequences. And defining the standards in such a product, which in my opinion is extremely complex, nothing to do with tobacco, is not as easy as it looks. It needs a significant interaction between the industry and experts, it needs investment, it needs a lot of research, and a lot of discussions. Thank you very much.